Do you have dense breasts? There's a chance you don't know the answer to that question. And what if you do? How can you use that information to your advantage? An Omaha family is on a mission. They want women and men to learn from their experience. John Carroll is a nurse, an attorney, and now breast density advocate. Also with us, breast surgeon Dr. Janet Grange. It's nice to have you back. And Dr. Grange, it's nice to meet you. John, before we get too far into this conversation, it's important to understand how this journey started for you and your family. Your mom, Michelle, inspired you. Would you tell us how and when she was diagnosed?
Sure. In April of 2014, my mom was diagnosed with breast cancer. Dr. Grange is her breast surgeon, who did an amazing job. And what we learned was my mom had a mammogram in August of 13, so 8 months prior, and she was told it was normal. And then in April of 14, she had a 7.5 centimeter tumor in her left breast, and which is, you know, what, about 3 inches, like a small lemon. And when I got the mammogram itself and looked at it, I saw a bunch of white stuff, but I couldn't see a tumor. And we put the mammograms up on Dr. Grange's screen at her office, and she explained to us what breast density was and where the tumor was.
I think we have that image.
Yes.
And so what do you want our viewers to understand, or had your mom known about breast density and the importance of it, could she have made a different choice or asked different questions in that August?
It's a good question because there's two parts to that. One is, and as Dr. Grange will explain, it's all about early detection. Mom's course of events was not going to change. I think she still was going to end up with a double mastectomy based on the type of cancer she had. But there was some metastasis into 2 lymph nodes, micrometastasis. And that 8 months is kind of a gray zone of maybe there would have been nothing in those lymph nodes had she been diagnosed in August.
Dr. Grange, the images we're looking at, would you help us understand the left compared to the right?
Yes, and the right is what we know is a dense breast, and actually this is Michelle's mammogram, and all of that white tissue is what a dense breast looks like. Now, if you understand what a cancer looks like, which on the left it depicts, that's what we're looking for with a cancer. We're looking for something white. Well, if you're trying to find a cancer that's white against a lot of white background, it simply blends in. So the radiologists are at a difficult situation when they're looking at a very dense breast. They know that it's possible that there could be a cancer hiding in there. They just don't have the ability to discern it.
So for our viewers who are watching now, John, as you're on this Are You Dense campaign, you want women to know the answer to that question for themselves. Why?
Sure. So there's I call it a mammography triad, and that involves the patient, the healthcare provider that orders the mammogram, and the radiologist that reads the mammogram. Somewhere along the way, breast density fell in the cracks between those 3 parties. Women that undergo a mammogram, and for most part at age 40, once a year, need to understand right out of the gate, do I have dense breasts? Breast density is more prevalent in younger women, and breast density itself is a risk factor, along with age and some other things. And so I want all women to understand that if you're going to go through the time and expense of a mammogram, understand what your mammogram is actually doing and what information it's providing. It's not just about, do I have cancer or do I not have cancer? It is a screening tool, but at the same time, not all breasts are the same. And some breasts are more dense than other breasts. And so you need to understand, until there's a uniform system, that you're at risk if you have dense breasts and you don't know it. So 2 things. When you get your mammogram, you need to find out if you have dense breasts, and if you have dense breasts, how dense they are.
How common is it, Dr. Grange, that women do have dense breasts?
Well, about 50% of women have some degree of density that can compromise a radiologist's ability to see clearly a cancer. Now, 10% of those mammograms are so dense that we miss over 50% of cancers. So the reason it's important for a woman to know that is that many times a woman might feel something is different in her breast. She goes for the mammogram, and when she gets the normal, to her it's an all clear, and so she never mentions it to anyone because she thinks, if this thing I can feel were something, they'd see it on the mammogram. If she understood that she had the kind of mammogram that you could easily miss something in, then she would share that information with someone who could then do some supplementary imaging, like ultrasound or breast MRI. That's the real power of this, is because women are the ones that know, is there something that I'm secretly concerned about? And you don't get access to that additional imaging if you don't know that you could benefit from it.
If you don't know. We have some information that John wanted us to share with you, that is sort of the heads up about self-exams, about mammograms. Dr. Grange, there's been a lot of controversy the last few years as we talk about insurance and different recommendations. At what age do you say to your patients, please start getting a mammogram now?
The American Cancer Society has actually exhaustively looked at the worldwide literature in terms of when do women benefit from a mammogram. And they've used a couple of benefits that we think are the deal breakers. This is the reason women are willing to get mammograms. They would like to reduce their risk of dying of breast cancer, and they would like to reduce their risk of requiring a mastectomy. In order to optimize those goals, the age to start is at age 40. Annually, we haven't figured out the late timeline. We know that there are a lot of women who probably could get away with less intensive screening. The problem is we don't know how to choose the woman who might not fall through the cracks.
And it's about saving lives for you
Exactly.
and John, for you. We are out of time, but I'd love for our viewers to go to your website. There's a beautiful documentary about John's mom, Michelle, and her story up online. If you'd like to visit, you see the website there, and we've got it linked back from our website as well. Please give our best to your mom.
I will.
We appreciate you being here, and it's great to meet you, Dr. Grange.
you.
Thank you.
Thanks, Mary.